Good day, everybody. One of the greatest achievements of human civilization is the provision of clean drinking water to huge numbers of people. The availability of large amounts of clean water and parallel developments in removing wastewater has probably done more to extend human life than any other development, including the invention of antibiotics. So this is an issue of critical importance. Welcome to our synergy session that we have called Water Quality Issues for Private Wells in Newfoundland and Labrador. My name is Mike Clare. I am the Associate Director for Public Policy at the Harris Center, which is a part of Memorial University, and I'm delighted to be your host here today. Both for those of you who are here with me in the Suncor area in St. John's, as well as those who are watching on the web. So welcome, everybody. Our event today is going to consist of an opening presentation of about 45 minutes. We'll have three presenters, and I'll introduce them all at the same time to save a bit of time. And then we'll follow with the Q&A session. We will finish at 1:30 Land time, because we know that you have work to do. So presentations followed by Q&A. For those of you who are in the room with me, we're going to circulate a wireless microphone so that the people watching on the web can hear your question or your comment. And for those who are watching on the web, there is a text box on your screen somewhere. Just send in your question, and Jessica will read it out for the panelists to address. We're recording this session for the webcast, of course, and then we'll archive it on the Harris Center's website afterwards. We're not going to archive the Q&A session, only the presentations. So feel free to be as candid as you want during the Q&A session. You can decide to record if you want. That's not going to show on the archive. Before we start, Jessica, do you have the wireless microphone? What we're going to do is go around the room and ask people to introduce themselves.
Use that one.
Use this one here? Okay. So just to briefly say who you are and what organization you represent, if any. We'll start with this gentleman here.
Steve Amor, head of the Brain Sciences section of the Geological Survey.
I'm Anne-Louise Hambach, master's student with Memorial University.
Lorelei Roberts-Sloter with Municipal and Intergovernmental Affairs. I'm the Director of Community Sustainability Partnership there.
Hi, I'm Mandy Strickland. I work with the Harris Center. I am also a Master's in Public Health student with the Faculty of Medicine.
Brian Fierce, Manager of Knowledge Mobilization with the Harris Center and interested in all things rural.
Hi, I'm Maureen Ryan. I'm a Senior Environmental Scientist with the Department of Environment and Conservation.
Hi, my name is Oleg. I'm studying oceans.
Jennifer McVeigh with the Harris Center.
Carl Wasson, Project Manager at MAN.
Brent Miner, I should get my name right. Brent Miner, Manager of Create Network at Memorial University.
Ryan Stack, President of the MAN MBA Student Association.
I'm Sidhu, and I'm here from the MBA as well.
Well, I'll introduce our speakers after. So welcome, everybody. We have a good mix of people here from government, university, private sector. So our discussion today will be led by three researchers who have recently completed a project on drinking water in the rural parts of the province. Dr. Abdul Sarkar is a public health physician teaching at the Division of Community Health and Humanities in the Faculty of Medicine at Memorial University. He is trained in medicine in India and did all his major public health degrees from India. Dr. Sarkar worked with the United Nations for several years in India and also worked in Africa. He studied environment at Queen's University in Kingston before coming to Memorial University. He has been involved in water-related research for nearly 2 decades. At Memorial, he's been involved in several research projects on water in Newfoundland and Labrador. Kaylin Thompson is currently completing his Master's in Applied Health Services Research at Memorial University, and today's presentation represents a large portion of his thesis work. Kaylin is also a full-time medical student at Memorial, where he leads active extracurricular groups on rural medicine, emergency medicine, the arts in medicine, and refugee health. An active researcher, he's also involved in research in each of these areas. Having grown up in small town Dipper Harbor, New Brunswick, Kaylin feels a particular strong bond to health issues in rural communities. Arifor Rahman is currently studying for a master's in public health at Memorial University. He was involved as a research assistant in the project under discussion today. Arifor is an international medical graduate from Bangladesh, where he worked as a family physician and as a researcher on arsenic contents of drinking water and its health hazards. He played a leadership role in a blood donation organization and an anti-smoking campaign in that country. He's done a systematic review on extensively drug-resistant tuberculosis with Dr. Sarkar, and the manuscript is ready to submit. He's interested in working on public health issues in underprivileged communities. So please welcome our speakers, and please welcome Dr. Atanu Sarkar to the podium. Over to you, Atanu.
Thank you. Thanks, Mike. Good afternoon, and it is a great privilege being here. And I really thank Harris Center for organizing this synergy session. My association with Harris Center started just after joining MUN. I can remember my first research project was actually funded by Harris Center, and I can cherish those memories, my meeting with Brian and Bob, and it was so enlightening and so encouraging that before that, I was really struggling to get some foothold to do, what to start, So Harris Center gave me a really great break and a lot of good directions, because I was totally new in this province. And after getting the first project in Harris Center, then I got a couple of more projects, and I mean, it's a long list. I don't want to waste my time, because it's a huge support from Harris Center, and I have no hesitation to say what I am today. Harris Center really made a really great contribution from the development. Well, and I also, before going for this presentation, I would like to acknowledge my co-workers, Maura Hanrahan and Amy Hudson, for this project. The project, actually, what I'm going to tell you, today's presentation, actually, it is, as Mike said, that we have three presenters. I have a student, Kaylin and Arifur. So the whole presentation in two groups. First, I will talk about this very briefly about the Black Tickle project, and then I will hand over the whole entire session to these two researchers. Well, so let's start with this one. Can you put the next slide? Sorry, is it possible? Okay, thank you. So this is the title. Now, just have a quick look about the Aboriginal population in Canada. As you know, that it is considered the fourth world. It is because of the different reasons, like this is one of the marginalized communities in this country, despite the fact Canada is considered one of the topmost countries in a Human Development Index, but the condition of the Aboriginal population is really, really very, it's an issue, and it is an international issue. In fact, the people always remind us that take care of this marginalized group. There's no point to remain at the top with the Human Development Index, but having the darker side in our back here. So it is very important to address this issue. And you can see that how Canada ranked in international level overall, and what is the situation actually in some remote areas. So the Aboriginal populations, they have a number of issues. One of the issues is water. And it is not unknown to everybody know that water is a major issue in many Aboriginal communities. And so what we wanted to do actually, that our study was to understand the multiple dimensional health risks and coping strategies of long-term water insecurity in the southern Inuit community of Black Tickle, Domino, and Labrador. It's one of the remotest communities in this province. We got this funding from Harris Center, also some financial support from Labrador Institute. That was the beginning. And later we got support from the President's Office. That was continuing now as a follow-up of this study. So this, you can see the location of Black Tickle. It is a tiny block, dot in the eastern coast of Labrador. And before, actually, there is no regular flight to have a Black Tickle. We had to actually charter, had a charter flight. It's very expensive. Even there's only have medevac basically for any kind of medical evacuation and medical reason. Otherwise, there is no regular flight. They get you know, the regular supply of the food and the stuff by ferries, and otherwise it is one of the most isolated communities in, perhaps in one of the isolated communities in this country. And you can see this this is a very tiny small community. So before the collecting data, we had this is the town council office. We had a meeting with the community. We had focus group discussion, interviews, and some participant observation and water testing. I don't want to go in detail, but the basic the findings I can share with you. The Aboriginal people is very much intimately connected with the water, physical, and spiritual health. It is the way we drink, think water is just H2O. But there, for them, water is not just H2O. It is very much linked with the culture, the values, their spirituality, the way they link water and the environment. And their, so that is not the way we, our Western perspective of water is different from the Aboriginal perspective of water. So the degradation of water environment results in deterioration of the health culture of the Aboriginal people and the communities. So now they have, it is not that they don't have water supply, they have the public water system. But for them, it is very expensive. You have to understand, it's such a tiny community, they don't have a regular job, except there are 3 people actually in the whole community having regular salary. One is nurse working in a health sector, one is the one person working in a Post Canada, and another person working in RCMP. There's only 3 person in the whole community having a regular job. All are supported by government subsidies. So we understand that economic condition. For them, paying money for this water is an expensive issue. And on the other hand, if they don't pay, the running this water treatment itself is also a big problem because it is not sustainable. So it is a very catch-22 situation that how to manage this water supply. So when public water is, it's an issue as far as the costing is concerned. The alternative is the pond, the wells. So this is the well. The left one, I took the photo in winter, almost in month of April. We had 2 visits in 2013 in April and in fall in August. So you can see the same well, and it is not actually the well. They say it's not a well. It is essentially a kind of narrow brook or ditch, and they develop a superstructure of a wooden superstructure and collect water. So it is not a well the way we actually define normally. So you can see the quality of water. It is a kind of brownish water with a full of organic stuff. You know, this water, they don't have that. Many of them don't have money to boil the water. Sometimes they drink water directly from this source. You know, so it is unbelievable. I mean, I worked in India and I worked in Africa, and I saw the water issues. I don't have any hesitation to say that the kind of water quality I have seen in Black Tickle, it is no way better than those countries. It is almost same, and I find it's more you know, the serious is because in a country like in Canada, which is considered to be having the highest per capita fresh water as per the UN definition of per capita fresh water, in the same country, you can see that some of the tiny spots, which is actually the shame. So we actually, you see the high quality issue. We have tested water quality. We found that E. coli is high in some areas. It is not from the human E. coli. It's basically, it is an open, ditch is contaminated with animal feces on wild animal feces on a regular basis. And also the solid waste management is not very good. And you can see that even in the water source, you can see all the some solid garbage. And even this, you can see the right side, the well, the people drink water from directly. You can see the plastics and the fallen leaves. So these are the water. It is a regular source of water. There is a free water, so many people prefer, and so and also the public water is also not very safe. There is we found the disinfectant byproducts are also there in public water. So in one hand, public water they're paying money, but that is also having some other chemical issue. So access issue, the way people collect the water, they bring all these, the tubs and collect. and the skidoo is the mode of transport. So again, there is another issue is the cost of oil, gas for running the skidoo. So this is the water you can see the collecting, that is the water for the whole family for whole day. So this water is for the all purposes, drinking, cooking, all, the sanitation, all. And we have found that this water is almost 1/3 of the Canadian's per capita average water consumption, and quality of water is also not that good. Then when there is a snowstorm or any kind of environmental issues, sometimes they cannot go to collect the water. So sometimes they remain, somehow they manage to save some water for the next day. So it is a really, really very terrible situation. Now also some of the wells become inaccessible during the winter. You can see this well, it is almost buried under snow. And some of the wells you cannot open the door because it's almost buried, submerged. So only during the summertime you can get access to those wells. And this is on a pond. Sometimes you collect water from frozen pond, and this is the water they collect. And the sanitation is another issue. There is no proper sanitation. Those were houses which are very close to the bay, they directly the excretors are direct dumped in the bay. And those who are little away from the bay, they simply collect in a schematic and collect in a manually and dump it in a. Now, what is the coping strategy? They have boiled water. There is a is an option, but it's too expensive because again, there you have to spend money on the power. That is also issue. So sometimes they manage it as simply they buy water, but water, it is if they buy the beverage like high sweet sugar containing beverage, that is the only option. But the outcome is the high level of obesity. I mean, you can see how the water insecurity is further aggravating their other health issues. Sometimes they compromise with the hygiene, same water they use for taking bath, whole family use the same bathtub, same water, and it is a men's job. It is like in many other countries, women take care of the water collection. Here it is men who collect the water. And many of them having this chronic musculoskeletal injuries because every day they carry 15 to 13 to 15 buckets a day. Even they have any health issues, they cannot go to the hospital because or prolonged treatment that is only available in Goose Bay. If they go to Goose Bay, there is no other family person to take care of the water collection every day. So sometimes they simply, suppress the pain by regular intake of painkiller. So this is a compromise. It is I think is very interesting, and this notice I have seen in a town office, in a public toilet, and it shows that how do they compromise with the water insecurity. It's funny, but it's a very harsh fact. So adverse health effect, we found that there is a frequent reports of outbreaks, and many of the outbreaks are not get reported in our regular newspaper, but that remains there. And also the obesity, musculoskeletal injury, mental health. Many people are very upset mentally because they know that because of the water, their kids are getting unhealthy options like unhealthy diet, and also, we found that how it is affecting the the personal hygiene, and many diabetes patients they blame indirectly the water might be one of the reasons because it's affecting their whole diet. They're drinking only high sugar water, which is more affordable than actual healthy water, which is more expensive. So urgent is sustainable strategy to improve the water quality and access, and we are actually in the process to doing that. We are trying to make it water more accessible. Currently, public water is quite far. So the President's office gave us some money to find options. Currently, the engineering faculty, Andy Fisher and Maura actually in charge of looking after the further actions, and they are trying to bring the water to the community and try to make it what is the best way to make the water more affordable. So before I end, I just again acknowledge the Black Tickle community, Harris Center, Labrador Institute, and President's Office for supporting this project. Thank you very much. And now I will hand over to Kellen and Arifur. Before that, I just want to tell you the context of the next presentation. After doing my couple of research on water, thanks to Harris Center for supporting those number of projects. I realized that there is a major concern of the water in the whole province is the private wells, which are not regularly tested by the provincial government, because provincial government mostly tests the public water. But then I realized the best way to improve the water quality is to have some facilities in this province so that the private well owners can get access to that. So, but I am not expert in the business, so we have to make some plan which is business-wise sustainable. So I teamed up with Tom Cooper from the Faculty of Business, and we did a project, and the project was taken as a research project for Kellen. So Kellen did major part of the data collection. Later, Arif also joined. He did some small but very important part of data collection. So both of these guys are now going to make a presentation.
Yep. Yep. Thank you very much, Dr. Sarkar, and thank you very much to all of you for being here today. So as Dr. Sarkar just mentioned, this project is exploring appropriate business models for establishing private groundwater monitoring service in Newfoundland and Labrador. So we're going to look at some of the issues that he just touched on and the availability of water testing for people with private wells in the province. Just an overview of the presentation. Going to start with a bit of background, what's happening now. Then we're going to talk about trying to identify the health risk here. And that's really the first pillar of this research, is creating a model to talk about what the risk to residents of the province who are drinking water from private wells might be. Then we're going to talk about solutions. If you're going to create a risk, let's talk about how we fix it. How we gathered information with that was 2 phases of interviews. The first phase I did, the second phase was conducted by Ari Fur. We identified several barriers and key results from those interviews, which inform the business model that we're going to talk about here today. Then, of course, we're going to talk about the limitations of that research and where we go from here. So currently, the government of Newfoundland and Labrador regularly tests public drinking water supplies to ensure the absence of any microbiological, physical, or chemical parameters. And that testing is based on a regular system. So that's public water supplies we're talking about being tested for both microbiological and chemical contaminants. These results are published through the Newfoundland and Labrador Water Resources Portal, which is a fantastic resource. It's very, very transparent. The information is available. Anyone can view it and see what the water quality results are. But when we talk about private water supplies, and this is mostly wells in the province, these fall outside of this regular testing regime, and individual well owners are mandated to be responsible for seeking the testing of their own water. If they want to test their water for microbiological contaminants, that is to say for E. coli, that's a service that's available through the Public Health Lab in the province, and many residents avail of that service and have their water tested. However, if they want to test their water for chemical contaminants, we're talking about things like arsenic or lead or different things like that that have health risks from prolonged exposure, that service is actually not available. And that's a key gap that has really caused this research to come into play. The recommendation of the government is to seek any testing for that from a private laboratory, but private laboratories are often not accessible because they're centered in St. John's and they're quite expensive. And there are an estimated 50,000 wells in the province, serving approximately 1/5 of the population, to give you an idea of the proportions that we're talking about here. So what is the health risk? What we did was go back and, using that water resources portal, look at public water source tests that were for wells. So some public water supplies are supplied by wells, and we use the results from those tests to look at wells in public water supplies that have shown past contamination. So this is not results for the private wells, because those wells aren't tested. We don't have that data. But in attempting to create a proxy model, we looked at results from public source water tests. So you get the idea. This is basically the closest proxy we had available data for to try and guess. And looking in the past, there had been contaminants of arsenic, barium, cadmium, chromium, lead, mercury, and selenium at least one time in those public groundwater wells. Now, public water supplies, the water is treated, and presumably municipalities take care of ensuring the safety of that water. But if this is private water, someone's individual well, and they don't know that their water is contaminated, then they're not going to be taking precautions or steps to ensure that any of these contaminants aren't present. So if you look at this, using the proportion of wells that showed contamination, and based on the information we have from Statistics Canada that the average household size in Newfoundland and Labrador is 2.4 persons, we can try and guess the number of people in the province that may have been exposed to a chemical contaminant from their private well water. And when you add up all those numbers, basically we're looking at about 5.6% of the population of the province that may have been exposed. Now again, this model is a proxy model. It's not based on data from the private wells, but because that water isn't tested, we don't have that information, which actually highlights the need for a water testing facility that would look at the actual contaminants that are in the real private well water. Based on those contaminants that we've identified, there's a host of potential health risks, and just in brief, these include cancer, cardiovascular disease, kidney damage, diabetes, neurological damage, and development disorders. Do we know for sure that these things are happening from exposure to contaminants in the well water? We don't, but it is a potential risk, and that's an important part of the fact that we are not testing these wells for the potential contaminants. So, what are solutions? As an initial approach for the first phase of interviews, I used a stakeholder approach to talk to different representatives from key groups around the province. I spoke to representatives from the municipal government, from the Provincial Department of Environment and Conservation. I spoke to medical professionals, laboratory professionals, and I did tour lab facilities to see what they're doing. And I also spoke with some private well owners. From those interviews, I was able to identify some barriers. Now, admittedly, it is a small sample size of interviews that I was conducting, which is where Ari Fur's component comes in, because he was able to conduct interviews with a larger group of people. But we were able to identify several barriers that informed the structuring of the business model. Barriers both from the perspective of the well owner and from the perspective of anyone who might want to run a laboratory that would be testing private well water in the province. And those barriers from the well owner perspective include things like cost. That was a huge one. Reporting challenges, understanding the report and what it's telling them about their well water. Public education was a huge issue, and Ari Fur will talk more on that just with regards to perception on drinking water. But in general, we found that if the water looks clean and tastes good, then it must be safe. And we know that that's not true because, for example, arsenic and lead are both tasteless and colorless when in drinking water. Other issues include accessibility to the service, the fact that some well owners are in rural communities. We're going to be dealing with senior citizens, so some challenges there, and also trust and reliability of the report. And then in terms of the laboratory challenges, from talking with the laboratory professionals, that really gave me an idea of what to include in the business model when projecting costs for this idea. And now to speak about the second phase of interviews, I'd like to invite Ari Fur.
Thank you, Callan, and good afternoon, everyone. So I was involved in the interview phase 2, and Our aim was to know the private well owners' knowledge and attitude towards the chemical testing and their opinions on establishing a sustainable business model on water quality monitoring. So as a mean of survey, we wanted to do a telephone interview. We developed a questionnaire with proper wording, and most of the questions were formulated as dichotomous, like a yes or no answer, and some were scaled to several points, and some were categorical, and the rest were open-ended questions. So this is a flow chart, how we develop the questionnaire. We did some background work by doing literature review of past surveys, and then we discussed among us about the question wording, and we draft a questionnaire. We send it to interviewers, human resource developers, and other experts for their review. And at the same time, we contacted Info Canada, and we got some contact numbers of the private well owners. And we did interview 10 well owners who were not later included in the survey. But we just did to get a review from them. And it was important because we found out that some wording in the questionnaire were a little bit difficult to understand for them. So later we changed them. And at the end, we got 80 private well owners for interview who were chosen randomly. So the results. Results were quite interesting, and most of the well owners, they were satisfied with the quality of their water. Only 16% participants were not satisfied, and the cause they told us mostly due to physical appearance, the taste, and bad odor. So 74% of the participants, they said that they tested the well water, but mostly these tests were done for microbiological agents. Only 13% tested the water for chemical contaminants. And the frequency of testing was different. Only less than 10% respondents, they tested the water yearly. And 18% of the respondents, they tested water once in a lifetime. So the other 26% who didn't test their well water, they thought that there was no outbreak of waterborne disease in the community, so they didn't need to test water. But nearly all of the participants, they thought that the chemical testing is important because by the time they got the news in the media that in some places there is arsenic in water, and they were worried about nitrate chloride also. And 73% of the respondents, they wanted to pay for the testing from their own money, but only 10% wanted to pay $50 or more. 95% of the respondents, they thought that publicly funded chemical lab within the province will serve the purpose and it will improve the water quality monitoring. They thought that it will be more accessible and the cost will be low and it will be more affordable for them if it is within the province and publicly funded. So 2/3 of the participants were in favor of having multiple partners in running these labs, and mostly they were in favor of provincial government and public health departments. Some of them said environmental agencies, and very few, only 2% said private partnership. So nearly 41%, they said that government subsidy is the most important thing to make this project sustainable. But 40% participants mentioned public awareness was the main important. And others think that having multiple laboratories throughout the province is important. And some say that involving local community, local municipality are important. So the business models, Callan will talk about the business models.
Thank you. You can leave that on probably for the questions. Thank you, Arifer. So based on that information, what's informing the business models that we're talking about. I looked at the costs and created a model that reflects these identified challenges, incorporates facility costs, and for the purposes of this research, I based it around a centralized facility established in Grand Falls. It doesn't have to be in Grand Falls, but I chose that as a place based on what the facility costs would be there at the centralized location of the province. A bit easier for transportation, so that's what was used for this exercise. I also included the costs of the laboratory equipment required based on the consultations with the industry professionals, maintenance of that equipment and of the building. I looked at staffing considerations and the amount of staff it would take to run this lab and handle the volume of tests coming in. I looked at sampling considerations and the costs, sample bottles, things like that that have to go out to actually get the water, laboratory supplies for running the lab, and then the fees for accreditation. What we're going to look at in the next slide is 3 sensitivity models based on these costs for different volumes of testing. And I considered these around the idea of each well participating in a test once every 2 years for these chemical parameters. So we're looking at biennial testing. And in those sensitivity models, so the first one would be a scenario where everyone participates. So of 50,000 wells in the province, everyone's participating in biennial testing. So that's 25,000 tests a year. Considering the equipment and the staff that would be required to run that, the bottom line, how much would it cost? And if you divide that all out over those 25,000 samples, we're looking at just over $50 a test to break even in this scenario. It might be hard to get everyone to participate. So something that might be a bit more realistic would be if, say, 25% of well owners participate in that biennial testing. So 25% of the 50,000 would be the 12,000. And then if half of that, 6,250, partake each year, what would be the bottom line of a cost per test? We're looking at just under $120, at $117.98. Finally, what if there wasn't great uptake and only 1,000 samples came in per year? In this case, we'd be looking at quite a bit more of a cost per test because, of course, we're not spreading the test over so many samples. And in that case, it would be $632.90 a test to cover that off. This lab, covering these costs, could be an effort mounted by private enterprise, could be something mounted by the government. Either way, we're really looking at similar costs, and the challenges are there. And the data from the interview showed that, in general, people were more likely to trust a lab if it was coming from the provincial government and some kind of government subsidy and partnership within government. So let's talk about the limitations of this research. As I mentioned, for the analyzing the health risk, I use public water supply data, not the actual private data that doesn't exist. There is geologic variation across the province, which has to be acknowledged, and aquifer characteristics that vary from well to well. Perhaps the wellhead protection of private wells would not be as good as the public wells that were what the test results were used from. So there might actually be a greater risk of exposure to private wells. Population calculations for that were based on assumed size per household of 2.4 persons, which of course is a projection, and the costs themselves are projections and are of course not exact. And each of those sensitivity models is estimating the testing volume to give you an idea of what the cost would be depending on the uptake and the participation from well owners in the province. Ultimately, though, these limitations of the proxy model suggest that the above model might be underestimating the health risk to private well owners in the province because of things like the wellhead protection and the fact that the water has not been tested. So in summary, there's a potential public health risk that we've discussed to just over 5% of the population. Some of the health risks that are at an increased risk from exposure are cancer, cardiovascular disease, kidney damage, diabetes, and neurological damage. And just to touch on that a little bit more, Ari4 mentioned from the interviews that people weren't connecting disease with water. But what we're talking about here is chronic illness, not acute illness. If you get a bout of stomach sickness from E. coli in the water, you might make the connection. I drank the water, I got sick acutely with some kind of infection. But when we're talking about cancer, and rates of colon cancer are very high in Newfoundland, we could be talking about exposure that's increasing your risk over a lifetime of drinking this water. So you're not going to make the initial connection because it's not exposure disease in a 1-to-1 ratio. We're talking about an increased risk over a lifetime of exposure. The business models show that a complete water testing facility in the province of Newfoundland and Labrador is possible, and I've outlined those costs for you. And this could be done, you could cover those costs by charging the residents, you could publicly subsidize it. That's an area for further work to determine how you would in fact mount that laboratory. So in conclusion, public water supplies, as I mentioned, are monitored and have mechanisms in place to ensure public safety. Engineering solutions exist to remove contaminants from private household water supplies. However, because of a lack of data and a lack of education, these measures are not taken. This is a hidden risk that is not only a public health burden, but also has financial implications for the cost of and treatment of disease. These risks are avoidable. A proper water quality monitoring system could provide the data necessary to alleviate this potential public health risk. Thank you very much.